all my wonderful TM joiners. I'm Priya Mistry, the TMJ Doc, and today we're going to be talking about the difference between a night guard and a TMJ orthotic or splint. Have you had experience with a dental night guard? Have you had experience with an over-the-counter night guard, one of those that you could get at the drugstore or the supermarket? Have you had experience with neither or both? Do you know what the difference is between a night guard and a TMJ orthotic? If not, or if you want the answers to some of these questions and more, please watch this video until the end. Before we get into it, be sure to check out my social media. The accounts are linked below, as well as my office website. My office website has tons of information on there as well, so be sure to check that out or give us a call to schedule an appointment. For those of you who don't know me, I'm a general dentist with a practice in beautiful Vancouver, Washington, where we are dedicated to taking care of patients with TMJ disorders. So let's get right into it. First, let's start by going over some terminology so that as I move forward in this video, everything I'm saying is very clear to you. So when I say over-the-counter night guard, I'm referring to one that you can get at the drugstore, the pharmacy, or a supermarket, and you sort of take it home and mold it and make it fit. When I say dental night guard, I'm referring to one made specifically for you by your dentist. When I say TMJ orthotic or splint, I'm referring to an appliance made by a dentist to treat TMJD. It can be confusing because a TMJ orthotic or splint and a dental night guard can look similar, but they function very differently. So getting the terminology correct right now will be helpful in understanding this video later on. Additionally, the words splint and orthotic can be used interchangeably. So just to keep it simple and easy, in this video, I'll be saying orthotic rather than splint. In this video, I'll be going over the differences between an over-the-counter night guard, one you can get at a store, a dental night guard, one made for you by your dentist, and a TMJ orthotic, one made by your dentist to treat TMJ disorder. Let's start with the over-the-counter night guard. Over-the-counter night guards are also called boil and bites because you can literally take them home and boil them and then sort of bite into them and mold them to fit. These are great at protecting your teeth from the forces of clenching and grinding, but that's about all that they do. To be very clear, an over-the-counter night guard will not treat a TMJ problem effectively. Many people get over-the-counter night guards to wear as protection from injury when playing sports as well, so that's just another thing to keep in mind. Many of these over-the-counter night guards can be uncomfortable because they're big and they're bulky and they're made to fit every mouth size, from Shaquille O'Neal size to the rest of us. So they can be bulky and uncomfortable and really hard to tolerate. I know many people that have tried these, they paid maybe $30 or $40 for them, and then they just couldn't tolerate them. So they ended up throwing them away or just leaving them unused on their nightstand. Let's move on to a dental night guard. A dental night guard is generally much more comfortable, and that's because it's a custom fit. Molds or scans are taken of the upper and lower teeth, and these records are then sent to the lab, and the lab sends back a custom fit night guard. These dental night guards typically fit on the upper arch, so they fit all the teeth across the upper arch. Now, there are different designs to dental night guards. There are also some that fit only in the front to prevent the back teeth from touching. There are some that fit on the lower arch, but what I see most commonly is the ones that fit on the upper arch and cover all of the teeth. A dental night guard, like an over-the-counter night guard, is very good at protecting the teeth from the forces of clenching and grinding, but it does not treat the muscles or the jaw joints. So let me repeat that. A dental night guard does not treat the dysfunctional muscles or the dysfunctional jaw joints that contribute to TMJD. So what does? This brings us to a TMJ orthotic or a TMJ splint. Like I said, I'll be using the word orthotic. A TMJ orthotic is also a custom fit. Molds or scans are taken of the teeth. And the next step, what's done next, is what sets apart a TMJ orthotic from a dental night guard and an over-the-counter night guard. The next step involves finding and recording the optimal position of the jaw in relation to the teeth. So this also bears repeating. The optimal position of the jaw is found and recorded. This recorded position, as well as the records of the teeth themselves, are all used in fabricating a TMJ orthotic, so that when it's worn, it's actually holding the jaw in a different position. It is a true orthotic. Like you would wear one in your shoe to correct hip alignment, a TMJ orthotic is worn on top of the teeth to correct jaw alignment while worn. Another way to look at this is that when worn, a TMJ orthotic actually changes the relationship between the upper arch and the lower arch, making it more optimal and more favorable for the muscles and the joints. When the jaw is held in that optimal position for a significant amount of time, good things tend to happen. We typically see pain go down pretty drastically within a month and a half, and we see jaw joint noises go down as well over time. These orthotics are very effective on their own to treat TMJD, but at my office, I also do myofascial release and osteopathic jaw manipulation every couple weeks for most of my patients. In addition to that, I also adjust the orthotics as we go along. The orthotic itself, this device that my patients wear, that cannot change, but every individual can. And as the muscles get to a healthier state, as the joints get to a healthier state, we have to adjust the orthotics as we go along to support and keep up with the body's changes. This modality of treatment, the orthotics, the myofascial release, the osteopathic manual jaw manipulation, and checking the orthotics and adjusting them frequently has proven to be very effective. And we have a 90% success rate at my office for treating TMJD. For more information, please watch my most recent video, How I Treat TMJD, which I've linked both above and below. So that's really it, my friends. Again, I'm Dr. Priya Mistry, and I hope you found this video helpful. If so, please feel free to like, subscribe, and share with your family and friends. For TMJD relief from the comfort of your own home, please download my free PDF guide called 3 Steps to TMJD Relief. You can find this on my office website, which I've linked below. This guide includes easy, quick, at-home remedies that will help you find relief from the pain that comes along with TMJD. As always, questions and comments are welcome below. Have you had experience with a dental night guard? Have you had experience with an over-the-counter night guard? If so, tell me about it. I'd love to hear from you. And remember, my friends, you can never have TMI about TMJ. Thank you.